Good evening, everyone, and great to be back with you on this holiday Monday. For frontline healthcare workers nationwide, of course, there is no break from the intensifying strain on hospitals. And tonight, there are new signs of just how dire conditions really are. CTV News has obtained this video from inside a hospital in Ontario that has turned one of its bathrooms into a patient room. Yet another troubling indication of a health system that has long been the source of pride and is now increasingly turning into a source of shame. Our critical care series this week investigates the problems and examines solutions. CTV's medical correspondent Avis Favaro starts us off.
Emergency doctors and nurses have been warning about a growing crisis within the country's ERs. Now a patient echoes their concerns.
The amount of patients that were, in this hallway or in this situation was overwhelming.
Siobhan Mitchell talked to CTV from inside a Toronto hospital, posting this photo on social media. She says she waited 48 hours in this hallway to get a bed for emergency surgeries and said she witnessed a flood of sick patients jamming the ER.
There's too many people, it's just so many people seeking care, immediate care, critical care, urgent care.
She praises staff and had a good outcome, but wants Canadians to understand ER overcrowding is real.
Until you are in it, you don't really understand how desperate and critical it is. It's terrifying, really is.
Both urban and rural emergency units are facing great strain offering urgent care because of staffing shortages and a flood of patients. And a new study from BC, reviewed by this ER doctor, shows that since the dramatic drop in ER visits early in the pandemic, hospitals there saw a rebound that continues to grow, with more patients with more severe diseases, more of whom who need a hospital bed.
It's what emergency physicians have been saying essentially since the summer of 2021 across Canada, that patients are sicker, the number of patients needing hospital admission are higher, and the challenge to that is that our hospitals are operating above 90% of capacity. Some hospitals are operating over 100%.
Because hospitals are full, newly admitted patients wait in the ER much longer. Last year, hospitals reported 90% of those waiting in ER got a bed within 40 hours. This year, it's up 9 hours to 49 hours. And when admitted patients stay in the ER, there's no room for doctors to treat the incoming.
We have to see patients in these unconventional spaces, like waiting rooms, like driveways, like closets, that patients don't expect, and they certainly deserve better.
It's a crisis of supply and demand, not enough hospital beds for an aging and growing population, along with an exodus of nurses and doctors. Earlier this year, ER physicians in Alberta and BC sent out letters, some warning patients not to come to emergency, saying overcrowding was increasing the risk of medical errors. And there have been some deaths this year, like that of 37-year-old Allison Holtoff, who waited hours in the ER for care. But this paper warns there may be more that aren't visible. Using a formula, doctors came up with a preliminary finding for what they say is a hidden pandemic.
Based on our population, you would find that over a year, somewhere between 8,000 and 15,000 patients are dying in Canada because of emergency department crowding.
Earlier this year, Ottawa handed the provinces an extra $46 billion to start fixing some of the problems in healthcare, including ER overcrowding. But health workers we spoke to said there are no signs of improvement, with emergency physicians and nurses now calling for a national forum to start fixing this urgent situation. Omar?
A situation that appears to be getting worse. So, Avis, is the issue that there isn't enough money, or that the money being spent right now isn't being done so effectively?
Well, money is an issue in that you need more beds. We have an aging population, and we appear to have sicker people who didn't necessarily get care during COVID. So that's an issue. But I think the underlying point here is that this has been a problem that existed before COVID, and there wasn't a lot of planning for what we have now. And any corporation, any entity should be planning for what's needed. That's what we've got the situation now.
And now we also know that fall is traditionally a time when patients head to the ER with respiratory issues. More of them do. What is your advice to them? What should they look out for?
Well, it is going to get busy, and that's part of the reason the doctors are worried. But if you do have to go to ER and you need care, please go. We just want you to know that you may have to wait, and please be kind to the staff, because they all say they're going through a record amount of abuse and violence because people are angry and upset at the situation we're in.
All right, Avis, great advice. Thank you. So good to see you again.
Thank you.
And Avis will be back here tomorrow with a look at the high number of rural emergency rooms shutting their doors. Our website has more on Canada's ER crisis and wait times. That's at ctvnews.ca.